So this is a different case, a companion case, because I really want to stress this point. So this was a 42-year-old woman who presented with abdominal pain and left lower extremity swelling. And about 5 years prior to her presentation to the emergency department, she had had a radical hysterectomy for cervical cancer. So we did they requested a duplex venous ultrasound of the lower extremity. And in this particular case, all the vessels were patent. So here is the right side. Again, by now, you know what I'm driving at, right? There is normal phasicity. This is an old case, so we were doing augmentation at the time. We don't do anymore. So there is normal phasic flow in the right external iliac vein, in the right common femoral vein. And on the left side, you can see that there is very monophasic flow. And if you have both sides to compare, that's really so striking. So I think it's important to always look at the contralateral side, at least one Doppler spectrum, which is our routine. And then when we looked at the vein itself, the right common femoral vein was compressing. The left was also compressing. It was a little hard to compress because the patient had pain, but basically the vein's completely normal size, no echogenic material within it. So again, we said there is no DVT, but because we saw this lack of phasicity, we said, okay, well, we don't see anything, but the patient needs a CT scan to see if there is anything more centrally. So again, just to recap, bilateral common femoral veins are compressible. There is flow demonstrated in both external iliac veins. However, there is what's more important, the dampened flow in the left external iliac vein with lack of normal phasicity. So let's look at the next step with a CT scan. And here you can see on the axial images as well as the coronal images that the vein itself is patent, maybe a little compressed, but what is really important, this patient has a necrotic mass in the left pelvic sidewall compressing the external iliac vein, and that is the cause of the dampened flow in the left external iliac vein. So in this particular case, if we hadn't paid attention to this dampened flow, we could potentially have sent the patient home because we did not see a DVT. And now this patient, that turns out, was lost to follow-up. And unfortunately for her, what this was a big metastatic nodal mass from squamous cervical cancer. And we know that squamous cell metastases are often necrotic, such as this node. Okay, so very, very, very important to pay attention to the Doppler spectrum. And so this is basically what we need is recognize the dampened flow on one side in a vein. You have to think about a more central pathological process.